to your 2023 benefits training. In our agenda, I'll review administrative reminders, medical coverages, health savings account, rates, EAP, benefits tools and resources. Then finally, we'll review the new enrollment portal and app. Thank you so much for taking the time to learn more about the benefit offerings that will be available to you while you're on assignment with us. To be eligible for benefits, you must work at least 30 hours per week. As an OGP, you will be automatically enrolled in our Consumer Choice Plan effective day one of your assignment. And there is a 30-day window from the day your assignment starts where you can make any changes to your benefits. In examples, if you start on January 15th, then you would be eligible to make changes to your benefits until February 14th. All employees enrolling eligible dependents in medical, dental, and/or vision coverage are required to submit documentation to the AMN benefits team. Eligible dependents would mean immediate family members like your spouse, domestic partner, or children up to the age 26. Documentation would include a birth, adoption, marriage certificate, or notarized affidavit for domestic partners. We also require joint documentation when you enroll spouse or domestic partners. Documentation must be submitted within 30 days of electing coverage, or your dependent's coverage will terminate after the 30 days has passed. Whenever you're ready to enroll, please make sure you have your dependent's social security number, date of birth, and documentation with you to ensure you have the easiest enrollment process. If you do not currently have a social security number for your dependents or yourself, you will be required to complete the enrollment and benefits over the phone with the AMN benefits team. If you do not enroll for your new hire window, the next opportunity to make changes to your benefits will be open enrollment, which usually occurs in the fall for changes effective the following year. There are a few exceptions to this rule where you may be eligible to make changes outside of your new hire window or open enrollment, and these would be called qualifying life events. So you're probably thinking, what is a qualifying life event? There are quite a few of them, but since a qualifying event could mean many things, if you feel like you may have experienced something that may qualify as this, you can always reach out to the AMN benefits team who will be able to verify this with you and will directly assist you with making these changes. Some examples of a qualifying event are birth, marriage, or say you were on AMN's insurance and your spouse got hired somewhere where they are offering insurance and you decide you would like to go on their plan. Or if you lost your previous coverage and you want to get on AMN's insurance, then that would also be a qualifying event. In order to drop our insurance coverage or get on it, you will need to be submitting documentation for this as well that proves that you or your dependents either lost or gained coverage, and the event must have been occurred within 30 days from the day you submit your qualifying life event. Just remember, if you are ever unsure about anything about your benefits or what you need to do, the AMN benefits team will always be happy to assist you with whatever you may have questions with. So that concludes our administrative reminders to remember, and on that note, we will start to go over our next item on the agenda, medical coverages. Before we jump into the medical plans AMN has available, I'd like to take a minute to talk about the difference between our PPO and our consumer choice plans. Both plans offer you the opportunity to manage your own care by accessing services that are from providers that are either in or out of network, and you do not need a physician referral to access specialty care. Looking at this table, you will see the PPO plan on the left and the consumer choice plan on the right. With AMN's PPO plan, you'll pay more in premiums, which is the amount you're paying out of your paycheck to be enrolled in the plan. By paying more per paycheck, you'll pay less when you access care because the PPO plan has copays. Copays are set dollar amounts or a flat fee for things like office visits, urgent care, and prescriptions. The PPO plan is our only plan that offers copays. What that means with the consumer choice plan is that if you need to access care, but you haven't used your insurance yet and you need to see a primary care doctor, then you would have to pay 100% of the cost until you meet your deductible. The deductible is the amount you'll pay each calendar year before the plan starts to share the cost of coverage with you. Both plans have deductibles. However, with the consumer choice, your deductible will apply to all medical services except for preventive care, which is always covered at 100%. On both plans, once you meet your deductible, then the plan will pick up the majority of the cost of services that are received after it. This is considered a coinsurance. It's important to take note of where you're at with your deductible so you know when the coinsurance starts. Our plans offer a 20 to 30% coinsurance, which is how much you will pay, then the plan will pick up the remaining. All of our plans also have an out-of-pocket maximum, and this is the total amount you'll pay per calendar year. After the out-of-pocket maximum is hit, your insurance company will pay 100% of costs after that. As mentioned, the premium will be the amount that gets deducted out of your paycheck to pay for your insurance coverages that you're enrolled in. Information into consideration, let's review the plans that AMN offers in 2023. I know there's a lot of details on this slide, so this is a great opportunity to note that this information is listed in your benefits enrollment guide, so you don't need to worry about jotting anything down here. From left to right, you have 5 plan options, which are sorted from the lowest to the higher coverages available to you. Preventive plan, consumer choice plans, PPO basic, and the PPO plan. That means that whenever you need to access care, the plans on the right will pay for more of the care than the plans to the left. The preventive plan is an appealing option for most of our employees, mostly because it has the cheapest premium available. As a reminder, the premium is the amount you're paying out of your paycheck to be enrolled in the plan. The preventive plan is mainly for preventive care only, and it does not cover any inpatient or outpatient services. This means that if you do experience a medical issue where it hospitalizes you, then this plan will not cover any of those costs. There is unlimited telemedicine care, which is basically a doctor you see over the phone or computer, which will cost you $15 per visit. Lastly, this plan does offer a limited amount of urgent care and emergency room visits just so you can have access to that care should you need it. But again, it doesn't cover any inpatient or outpatient services. Consumer Choice Plan is our next plan option, and this plan is the only plan that is eligible for a health savings account or HSA. This is also the plan that you'll be automatically enrolled in as a new hire. And in a bit, we'll talk more about the benefits of participating in a health savings account with these plans. As we discussed on the previous slide, with the Consumer Choice plans, you must meet the deductible before the plan will start to share the cost of coverage with you. If you're covering anyone else on these plans, you must meet the family deductible before the plan will cost share with you. So if you're covering yourself only, then your deductible will be $3,000. And if you're covering dependents, then your deductible will be $6,000. Once you meet your deductible, you can see here that the cost for a primary care visit will be 20% coinsurance, which means that you would pay 20% of the claim, and then the insurance will pick up the remaining 80%. Next is the PPO plans. The difference between the two PPO plans is the PPO Basic has a much higher deductible and out-of-pocket maximum than the PPO plan in exchange for a lower premium per paycheck. The PPO plan will have you paying more per paycheck than the PPO Basic, but ultimately paying less when you're accessing care. This is extremely beneficial for someone who will be needing to access care more often. Your medical carrier will be Blue Cross Blue Shield, and in some cases, Kaiser may be available. When you're enrolling in the benefits portal, you'll be able to see the plans that are available to you in that area. It's important to note that if you are eligible to elect Kaiser plans are in-network only. This means that you must use physicians within the Kaiser network. With the exception of emergencies, if you use the physician that is outside of the Kaiser network, you'll be responsible for 100% of the cost of that claim. If you enrolled in the Kaiser plan, then you must also utilize Kaiser pharmacies when picking up a prescription. Each medical plan has a specific pharmacy program bundled to it. With the PPO plan, you can pick up prescriptions without having to meet your deductible. On our Consumer Choice plans, you will need to meet your deductible before the plan shares the cost of drugs with you. Once you're enrolled in a plan, it's important to remember that AMN has tools for you to help you use your plans wisely. Here's a couple tips on how you can save money when accessing care through the AMN plans. Number one is stay in network whenever possible. These providers have contracted with the carriers and can't overcharge on claims. Better for you and better for AMN. If you ever need help locating an in-network provider, you can call our partners at Health Advocate. Number two, negotiate your bills. When you receive bills for more expensive services, call the provider and negotiate the expense. If you pay now, will they reduce the bill by 20%? Our Health Advocate team can negotiate your bills for you, as well as help you review your bill to ensure you're being charged correctly. Number three is become a consumer in your healthcare like you are when you're purchasing a TV. Say you have a sore throat or something minor and you need to receive care for it. You can go to the doctor, urgent care, or emergency room, but you want to figure out which route would be less expensive to you. Those are our three big tips to help you save money when needing to access care. See the costs, on average, associated with going to an emergency room for a sore throat and cough versus an urgent care or a telemedicine provider offered through your carrier. You can see that the ER would cost you between $150 to $200, and you'd spend an average of 4 hours here, which is extremely time-consuming for someone who only had a sore throat or cough. The urgent care visit isn't as costly, but you'd still spend almost an hour there, which is still not the greatest option. Finally, if you look at the telemedicine option, which is available through all carriers we contract with, you'd spend only 20 minutes with a professional doctor and only spend $49 instead of almost $200 or $75. Now, in the event of a true emergency, please don't hesitate to go to your nearest emergency room. If it isn't life-threatening, though, know that there are alternative options out there that are usually much quicker in nature and less expensive to you. The Home Savings Account, also known as the HSA, is a savings account for your consumer choice plan. The benefit of this account is for you to contribute pre-tax dollars that can be used for healthcare expenses, ultimately reducing your taxable income and allowing you to save for upcoming healthcare expenses. You are only eligible for this benefit if you are enrolled in the Consumer Choice Plan. When you go through your enrollment, you'll be electing a per pay period contribution for this account, which will be deducted each paycheck. These deductions are decided by you and the amount can be changed at any time through the Connect Health portal. HSA funds can be used for qualified medical expenses such as deductibles, co-payments, as well as many other expenses such as dental, vision, and chiropractic care. A debit card will be provided to you and the funds will be available for use once the contributions have been deducted from your paycheck. The other great thing about these accounts is that unused balances will roll over year to year, and if you leave employment, you take your savings account with you. This account does have a maximum annual contribution that has been increased by the IRS for 2023. The individual max is $3,850 and the family max is $7,750. When you enroll in a Blue Cross Blue Shield Texas medical plan, you'll receive guided access to excellent surgical care with Surgery Plus. Surgery Plus provides you with access to the best, most affordable care for many planned surgical procedures. It's already included in your medical benefits at no additional cost to you. With Surgery Plus, they will cover the most expensive costs associated with surgeries like consultations, anesthesia, procedure fees, and more. Please note, if you're enrolled in a PPO plan, your Surgery Plus benefit covers your surgery at 100%. If you're enrolled in an HSA plan, Surgery Plus will collect your reduced deductible at the end of the year. Here's the weekly rates for 2023. As you can see, the preventive medical plan is free for employee-only coverage. This is to remind you that EAP is available to all of our employees. This program is free and they can get up to 8 counseling sessions per year. Here are some of the tools and resources for you. We have an external AMN benefits team that you can connect with if you need help in the enrollment process or have benefit questions. You can call Health Advocates to get personalized assistance like finding network providers, help resolve billing issues, understanding your plan options, and which plan is best for your family. For EAP, you can reach out to ComPsych. For 401k questions, you can call Empower. For 2023, we will be using the AMN Healthcare Benefits portal powered by Winston. You can visit amnhealthcarebenefits.com to create an account and get started. Please refer to the Benefit Enrollment Guide for additional enrollment instructions. We are excited to provide a new mobile app to better equip with the information you need on demand. Saving the My Benefits site to your phones will give you access to the information you want. You will have access to the benefit plan information, generic ID cards, instructions on how to enroll, and a provider directory. Thank you for taking the time to learn more about your benefits, and we wish you a happy and healthy 2023.